Drug dosage forms. This video I like to present in two parts. The first part of the video is a pharmacy prep review on high yield points and most common tested questions from drug dosage forms. And then, in continuation of that, the second part of this video will be the Pharmacy Technician Certification Board exams, styles, questions and answers, or mock exams. Let's start. The drug dosage forms here divided as solid dosage form, liquid dosage forms, and semi-solid dosage forms. First, let's start off with solid dosage forms. Solid dosage form further divided in tablets, capsules, powder, granules, lozenges, and suppositories. So here let's start with tablets dosage forms. Tablet dosage forms are the most commonly used dosage forms of the drug dosage forms. And the tablet is a compressed solid dose medicine in the tablet forms, which may contain excipient or may not. Excipients are inactive substance that supports the preparation of the tablets, and also it helps in delivering and also having the stability of the tablets. So there are several types of tablets. I like to go over some important types of tablets. Compressed tablets. Compressed tablets are plain tablets without coating. Generally, they're designed to release immediately. Example, metformin IR. Next, enteric coated tablets. These enteric coated are coated to prevent dissolving in stomach acid or to prevent stomach irritation, and these drugs are coating or formulated to release in small intestine. For example, ecotrine or enteric coated aspirin. Sublingual tablets. Sublingual tablets absorbed under the tongue. For example, nitroglycerin sublingual. Sublingual tablets are bypass the first pass metabolism. That means they do metabolize before it distributed into blood circulation in the liver. And sublingual tablets have a direct systemic absorption, so therefore they do produce quick onset of effect. Next, buccal tablets. Buccal tablets dissolve between cheek and gum. Example, a Nicorette or nicotine gum, which is designed to also bypass the first pass metabolism, and also they do have a quick onset of effect. Film coated tablets. Film coated tablets are designed to mask the taste and also improve the appearance. For example, atorvastatin, brand Lipitor. Orally disintegrating tablets or ODTs, as the name tells you, they dissolve on the tongue or they disintegrate on the tongue and helps to uh, minimize the nausea vomiting. This can be taken without water, so therefore this can, like brand Zofran, ondansetron is used as an antiemetic. Chewable tablets, chewed before swallowing. It comes in various preparations. For children, there's a children Tylenol or acetaminophen. Other ones are layered tablets, multiple drugs or release phases, such as Dayquil, Severe, cold and for flu. Effervescent tablets dissolve in water before use. An example is Alka-Seltzer. So effervescent tablets have to be dissolved in glass of water and one have to take the water. Here next I like to discuss more about special release tablets. All special release tablets have to have a label, do not crush or chew, because they are specially designed to release a specific release patterns or release mechanisms. Extended release, short, ER or XR, formulated for long and slow release over time. For example, Wellbutrin XL, generic is bupropion, which is taken once daily. Delayed release, as the name tells you, delay the release of the active ingredient either for avoiding degradation in the stomach acid or designed to release one specific site of gastrointestinal tract. Example, Protonix, pantoprazole DR. Control release, formulated to deliver medication steadily, maintaining consistency therapeutic levels, so it reduces the frequency and also maintain a steady levels of drug concentration. For example, Toprol XL, metoprolol succinate is a controlled release. Osmotic control release use water pressure for steady drug release in the gastrointestinal tract. Example, methylphenidate brand Concerta. Biphasic multi-layer tablets combine immediate and extended release. I mean, there are two release patterns in one tablets, like Ritalin XLA, which is containing generic methylphenidate. Next, here are the most commonly tested questions in the board exam from the tablets. Enteric-coated tablets prevent stomach degradation and release in intestine. Sublingual or buccal tablets avoid first pass metabolism. Immediate versus extended release, know which drugs are not crushed. Like all extended release dosage forms are not crushed and chewed. Next, capsules. A capsule is a solid dosage form in which drug is enclosed in a hard or soft gelatin capsule. So there are two types of capsules, hard gelatin capsules and soft gelatin capsules. Hard gelatin capsules are made with the two pieces of shells and they fill with the powders or granules, not for liquids. I mean, no liquids are used in these hard gelatin capsules. And hard gelatin capsules can be opened if labeling allowed and also sprinkled on food. Depends on the specific drug formulation. Here, omeprazole, DR, Prilosec, Depakote, sprinkle that can be sprinkled on the food. Soft gelatin capsules are one-pieced sealed shell filled with the oils or paste. Cannot be opened and it is designed to enhance absorption of lipid-soluble drugs. For example, vitamin D3, omega oils or comes in soft gelatin capsules. The commonly tested questions on these capsules are hard gelatin contain only powders and granules or beads but not the liquids, whereas soft gelatin contain liquids and oils. And capsules can be sensitive, so therefore it often tested on the storage conditions of the capsules. Next, powder dosage form. A powder is dry, finely divided solid dosage form containing one or more internal or external use. So, powder can be divided into two types: internal use powders and external use powders. Here are the internal use powders. The best examples: bulk powder for solutions. Mean these powders have to be dissolved in water before it taken. Example: polyethylene glycol, which is used as a laxative, have to be dissolved the powder in the glass of water and have to be taken the water. Or antibiotic powders are supposed to be reconstituted before taking them or using them. Like amoxicillin oral suspension comes as a powder, however, you have to reconstitute with distilled water before you make them into suspension. Effervescent powders are generally used for analgesic, generally dissolved in water, and water is taken. There are sachets powders for high volumes or high quantities, such as cholestyramine, which is used for anti-cholesterol drug, whereas external use powders used for direct application, generally for antifungals, such as miconazole for athlete's food sprinkle on the food. Antibacterial powders such as bacitracin zinc topical powder for wound protection, moisture absorbing powders Zsorb for antifungal and drying agent, oral hygiene powder for dental cleaning or mouth irritations. The commonly tested questions in the powder dosage forms are internal use powder dissolved in water, external use antifungal powder for direct application. And also exam focus on calculating the measuring the accuracy of compounding powders. Granules are larger than powders. Often they are filled in the sachets, commonly used for pediatric or large volume drugs. And water can be added anytime to prepare the solution of the granules. Next, liquid dosage forms. Liquid dosage forms are comes in solutions, suspensions, syrup, elixirs, tincture, and emulsions. Solution is a clear liquid dosage form in which the drug is completely dissolved in solvent. So it is a clear liquid and drug is dissolved in solvent. So there are two types of solutions: aqueous solutions, non-aqueous solutions. Aqueous solutions are solvent is water, and oral solutions, for example, loratadine, Claritin brand, that is used as an antihistamine. Ophthalmic solutions such as latanoprost, eye drops, injectable solutions such as furosemide, and injectable and ophthalmic solutions are sterile preparations. And also nasal solutions such as fluticasone, that's also sterile. However, mouthwash, gargle, chlorhexidine, which is antibacterial, used as a mouth rinse. Irrigation solutions are used as a sterile preparations, which is sodium chloride irrigation for irrigation of the organs. The non-aqueous solutions, as name tells you, they do not contain water. They contain like otic solution of ciprofloxacin, dexamethasone, ciprodex, contain glycerin and alcohol. And clindamycin topical solution like Cleocin T, which is an alcohol-based solution. Testosterone, deposed testosterone is oil-based injection solution, whereas vitamin D also comes as an oil-based vehicle solutions. The takeaway points for liquids or most commonly tested questions in the exam for the liquid are ophthalmic and otic nasal forms must be sterile. And also storage condition for especially for Alcohol-based solvent liquids have to be tightly sealed containers to prevent the evaporation. Next, suspensions. Suspensions are liquid dosage forms with solid particles dispersed in liquid. That means solid particles in liquid is a classical example of suspensions. Types of suspensions are internal use suspension or external use suspensions. Internal use suspensions, best examples of widely used are antibiotics oral suspensions. They're supplied as a powder but used as a suspension after reconstituting with distilled water. Antacid suspensions such as NAPLEX, which is a combination of aluminum and magnesium, generally used as an antacid for or dyspepsia. Analgesics antipyretic suspension comes for children, Brufen oral suspension brand with the Motrin, antifungal suspension, nystatin oral suspension for oral candidiasis. This is one of the suspension taken orally, however, has no systemic absorption. External use suspensions are topical antibacterial suspensions, such as clindamycin topical suspension for topical applications, a steroid lotion suspension like fluocinolone for scalp dermatitis. Suspension, the most commonly tested questions on the suspensions include need shaking before use. All suspensions should label shake before use. And also commonly tested antibiotic suspension storage condition. Most antibiotics are stored for at room temperature fridge for 14 days, but depends on the specific suspension. Like amoxicillin suspension can be stored at room temperature for 7 days. However, in the fridge have to be stored in 10 days. Azithromycin suspension stored at room temperature for 10 days. So each suspension are having different storage condition, which is given in our other video for antibacterial videos. Next, syrup. Syrup is a concentrated aqueous solution, which is a sugar in water or artificial sweetener. So if you add sugar and water, basically it becomes a syrup. So syrups are examples. Diphenhydramine antihistamine syrup is a very popular one. Benadryl, generally used for allergies and cold symptoms. Dextromethorphan syrup, used as a cough suppressant. Hydrocodone chlorpheniramine, used for combination for upper respiratory symptoms. Acetaminophen syrup, analgesics for pain and fever. Loratadine, non-drowsy antihistamine for seasonal allergies. And guaifenesin syrup for expectorant or productive cough. These are the very popular syrup. Most of them contain sugar. However, there are sugar-free syrups also available for those who are diabetic patients. Next, the commonly tested question on syrup is it is a syrup that is a sugar-based water, so it need not to shake syrups. You don't need to shake it. Next, elixirs. Elixirs are clear liquid preparation. They do contain alcohol around 3 to 25% and used for oral administration. So elixirs, since they contain alcohol, not suitable for small children or pregnant women or those who have a chronic liver diseases or those who have a alcohol sensitivity. Elixirs examples diphenhydramine, which is a Benadryl antihistamine, phenobarbital elixirs used for seizures management in children, however, not less than 2 years. Hydroxyzine elixir for anxiety, nausea, dexamethasone steroid for inflammations, and acetaminophen as a pain or fever elixir. The most commonly tested question on the elixirs are alcohol based. So therefore it requires precautions in certain specific populations like pediatric and hepatic disease patient. Tinctures are higher content of alcohol containing preparations than the elixirs. So therefore, these are naturally obtained extract from the plant extracts and added into the high content of alcohol. So therefore, like iodine tincture is one of the popular one used for topical antiseptic, and other one is capsicum tincture used for joint muscle pains. It works like a counter irritant. So the commonly tested question on the tinctures are alcoholic extract not suitable for pediatric and alcohol restricted patients. Next, emulsions. Emulsions are liquid in liquid, right? Liquid diffused in other liquid. For example, water in alcohol or alcohol in water. Sorry, oil in water, my mistake. Oil in water or water in oil. So those two combinations are emulsions. So again, I repeat correction here. Emulsions are oil in water or water in oil. And the best way to remember is liquids are diffused in liquid. Mean there are both of them are liquid. One liquid is a oil, other liquid is a water. If there is a high content in the water, then you call oil in water. If oil content is more, then you call water in oil. So there are types of emulsions. So here, examples of the drugs that are emulsions are propofol, which is used for IV anesthetic, which comes in the lipid emulsion form, cyclosporin ophthalmic for chronic dry eye treatment, lipid injectable emulsions are used as parenteral nutrition, TPNs, and then testosterone topical emulsions for hormone replacement therapy for hypogonadism. Lidocaine prilocaine emulsion comes as a brand name called Amla cream, topical anesthetic for minor procedures. And there are steroids for dermatitis. And permethrin topical emulsions are used for treating scabies and also head lice. The commonly tested question on emulsions are liquid in liquid, two immiscible liquids, or dispersed in liquid. Next, semi-solid preparation. Semi-solid preparation include ointments, creams, gels, and paste. Ointments are usually greasy, occlusive, intended for external application to the skin and mucous membrane. So, as name tells you, the ointments have more occlusive bases like petrolatum base, etc. So that make them more greasy and sticky. But it helps for sticking well for skin, especially the wet surfaces of the skin and the dry skin areas. Here, the best examples of ointments are hydrocortisone ointment, comes in various potencies, generally used for inflammation, dermatitis, itching. The high potency steroid triamcinolone, which comes as a medium strength steroid for dermatitis, capsaicin ointment used for joint pains or also post-herpetic neuralgias, nystatin ointment for antifungal, mipirocin, which is a bacterioban antibiotic, topical antibiotic for skin infection. Tacrolimus, which is a very popular protopic for eczema, those who cannot tolerate or not responded by topical steroid, also can be applied on the face. Next, next ones are about most commonly tested questions in the ointments are greasy, occlusive, best for dry skin or also water areas. Commonly tested questions are generally the lesion types. It is what type of product would you select. Next, creams. Creams are semi-solid emulsions. Typically, it is more cosmetic, less greasy than ointment, and therefore it is topical application to skin or mucous membranes. So, best examples of creams are clotrimazole cream, are generally used for um, superficial fungal infections such as athlete's foot, jack itch, ringworm. Those are the great examples. And hydrocortisone cream, steroid for inflammation and itching, and mometasone furoate for more potent steroid for eczema and psoriasis, metronidazole for rosacea for and also topical skin infections, permethrin cream for scabies, terbinafine cream for antifungal tinea infections. Ketoconazole comes as a cream, also comes as a shampoo. Both of them are used for seborrheic dermatitis or dandruff. Creams, the commonly tested questions on the cream include they are made of oil in water, water in oil preferred for moist lesions. Better choice for larger area of applications, and also they are not greasy and cosmetically suitable. Next, gels. Gels are solid diffused through a viscous liquid. So basically, they do are sticky, transparent, jelly like consistency, and they do have a drying effect. Best examples of gels are diclofenac sodium gel, which is brand is Voltaren for arthritis, adapalene gel, Deferin for acne, benzyl peroxide for acne, metronidazole gel for rosacea or skin infections. Other steroid gels also available. The commonly tested question, the gel or could be a water or alcohol base, then they do have commonly drying effects. Next, paste. Paste or semi-solid preparation containing high proportion of insoluble solids, or it is a more thick preparation, generally used as a protective barrier on the skin. And also they are effectively stick to the specific areas of the skin wherever you wish to apply it. Examples of the popular paste are zinc oxide paste used for diaper rash, salicylic acid, steroid paste for dental paste, capsaicin paste, coal tar paste for psoriasis or eczemas. Commonly tested question on the paste are thick and high solid content used for skin protection as a layer. The next part, I like to continue with the mock exam style questions for pharmacy technician certification board exams from the drug dosage forms. So let's start. Which of the following solid dosage form bypass the first pass metabolism in the liver? A. Oral tablets. B. Oral capsules. C. Sublinguals. And D. Oral suspension. The correct answer is sublingual. Sublingual tablets bypass the first pass metabolism in the liver and also known to have a faster systemic effect. What is the primary reason for using enteric coated tablet like enteric coated aspirin? A. Faster absorption. B. Better taste. C. To prevent stomach irritation. D. To make it chewable. Correct answer is C. So, being enteric coated, it prevents the stomach irritation. So, they delay the drug release until the tablet reaches this intestine and protecting the stomach lining. So, therefore, the correct answer is C. Which tablet formulation is specifically designed to dissolve on tongue without water? A. Delayed release tablets. B. Buccal tablets. C. Orally disintegrating tablets. D. Controlled release tablets. Correct answer is C. ODTs like Zafran, ODT dissolve rapidly in the mouth and are helpful for patients with nausea and or difficulty in swallowing. Which route of drug administration involves placing the dosage form between the cheek and gum for absorption through the oral mucosa? A. Sublingual, B. Oral, C. Buccal, D. Nasal. The correct answer is buccal. The buccal routes of delivers medication by placing it between the cheek and gum, which allows the direct absorption into systemic circulation while bypassing the digestive system. Next, which drug form is designed to release drug at a predetermined rate to maintain consistent drug concentration in the body over extended period? A. Immediate release. B. Sublingual. D. Controlled release. C. Controlled release. D. Effervescence. The correct answer is C. Controlled release formulations are designed to deliver medication steadily over time and maintaining consistency therapeutic levels, reducing the dose frequency. Which dosage form is specifically designed to release the drug at time rather than immediately after administration? A. Extended release. B. Delayed release. C. Immediate release. D. Orally disintegrated tablets. The correct answer is delayed release. The delayed release formulation, which is example, can be enteric-coated or could be other sites of the GI tract, avoid the degradation in the stomach or the release into specific site of intestine. The main factor here is delay the starting time. What is the term for inactive substance used as a vehicle or filler in a drug product? A. Active ingredient. B. Excipient. C. Solvent. D. Binder. Correct answer is excipient. Excipient is an inactive substance that is used in the vehicle for the drug formulation, which helps in stability, absorption, and also providing, they do not affect on the therapeutic effect of the drug. Which of the following is a clear, sweetened hydroalcoholic liquid preparation intended for oral administration? A. Syrup. B. Suspension. C. Elixir. D. Tincture. Correct answer is elixir. Elixir is a transparent, sweetened alcoholic solution used for delivering medication orally, often improve the taste and also the stability. But this require precaution because this contain alcohol. Why are some liquid medications such as amoxicillin suspension stored in the refrigerator after reconstitution? A. To activate the drug. To B. To thicken the formula. C. To prevent bacterial growth and preserve potency. And D. Separate the particles. Correct answer is to prevent bacterial growth and preserve potency. Because refrigeration slows down degradation of the drug, which helps to maintain stability of the drug. Simethicone oral drops are primarily used for which condition? A. Nausea. B. Infant colic or gas relief. C. Cough suppression. And D. Constipation. Correct answer is infant colic and gas relief. Simethicone is a helps in break up the gas bubbles in the stomach and intestine, and often that is used for babies with colic or also can be used for other gas related condition in other age group. Which of the following liquid dosage form is absorbed fastest in the body? A. Suspension. B. Solution. C. Elixir. And D. Emulsion. Correct answer is solutions. Solutions, they are ready to absorb because they do not need to disintegrate and dissolve. So they already dissolve and disintegrated. So therefore, they are faster absorbed than other liquid dosage forms. Next, which of the following is a characteristic of an ointment? Water based, easy to wash off. B. Alcohol based, drying effect. C. Greasy and occlusive, best for dry skin. D. Used only for systemic effects. Correct answer is greasy and occlusive, best for dry skin. Ointments are oil based and create a barrier, making them ideal for dry, scaly conditions. Which characteristic differentiate a solution from suspension? A. Color. B. Solubility of the drug particles. C. Alcohol content. D. Volume per dose. So, suspensions are particles in liquid. So, therefore, there are solubility of particles. A solution drug is fully dissolved. In suspension, particles are dispersed but not fully dissolved. Which of the following medication types specifically required the use of personal protective equipment during handling to prevent exposure risk? All high alert medication in all settings, chemotherapy drugs, high alert medication in acute care settings, and high alert medication in long term care settings. Correct answer is chemotherapy and neoplastic drugs require personal protective equipment for handling them because of exposure of hazardous substances. Which semi-solid dosage form is most appropriate for application to hairy areas such as the scalp? A. Paste. B. Cream. C. Gel. And D. Ointment. Correct answer is gel. Gel can be easy to spread in the hairy areas. Because gel is non greasy, water based, and dries quickly, making them ideal for use on the hairy skin. Which of the following is a key benefit of using cream over ointment? A. Slower drug release. B. Easier to remove and less greasy. C. More protective on the skin. D. Lower drug absorption. The correct answer is easier to remove and less greasy. Creams are less oily and preferred when patient want a formulation that is easy to wash off. Diclofenac sodium gel is indicated for A. Topical fungal infections, B. Allergic dermatitis, C. Osteoarthritis for joint pain, and D. Constipation. Correct answer is osteoarthritic joint pains. Voltaren gel is a topical NSAID which is used for pain or joint pains in osteoarthritis. Which of the following oral suspension is not systemically absorbed and acts locally in the gastrointestinal tract? A. Amoxicillin. B. Nystatin. C. Metronidazole. D. Azithromycin. Correct answer is nystatin. Nystatin is oral suspension absorbed into the bloodstream, will not absorb into bloodstream and work local in the mouth and GI tract. Mainly it is used for oral thrush which happens around the oral cavity. Which of the following is a controlled release opiate analgesic? A. Brufen. B. Oxycontin. C. Acetaminophen. D. Morphine IR. Correct answer is Oxycontin. Oxycontin is used for continuously release, controlled release dosage form. Contin for continuous. So generally used for chronic pain and it is used every 12 hours. Toprol, metoprolol succinate is an extended release beta blocker that is dosed every 4 hours. once daily, before each meal, or only at bedtime. It is used once daily. Extended release formulation provide steady control of the blood pressure in a 24 hours, so therefore it is used once daily. Which solid dosage form technology allows lisdexamfetamine Y1s to provide extended stimulant effect while reducing abuse potential? A. Sublingual burst. B. Enzyme activated prodrug. C. Osmotic release mechanism. D. Matrix coatings. Correct answer is enzyme activated prodrug. Vyvanse is a prodrug activated only after digestion, making it long acting and harder to misuse. Why should enteric coated naproxen not be used for acute pain relief? It is not absorbed, it causes constipation, it releases too slowly for rapid effect, it is only used for sleep. Correct answer is it releases too slowly for rapid effect. Enteric coated preparations are not used for acute pain relief because it does delay the release gradually and not suitable for immediate pain relief. Cadian morphine sulfate extended release capsules contain pellets that can be sprinkled on the food. Which of the following is true? The pellet must be crushed for full effect. The pellet can be chewed. The pellets must be swallowed as a whole. The pellet may be sprinkled but must not be chewed. The pellet may be sprinkled but not to chew. It is swallowed as a whole. And it's chewed, then it destroys the extended release mechanism, then it can lead to the overdose effect. Glumetza, metformin extended release, uses gastric retentive system. What is the advantage? Fast pain relief, longer stomach retention for extended absorption, prevent allergic reaction, increase appetite. Correct answer is glumetza works like a long acting by staying longer in the stomach, allowing to this extended release period. And that also helps to reduce some GI side effects of metformin. Here the last question of this test. Ascol, brand name, which is a mesalamine delayed release tablet, is used for ulcerative colitis because it dissolves in the stomach to treat acid reflux. It absorbs in the rectum only. It delivers drug directly to the colon based on the pH sensitivity coating, and also D, prevent constipation. The correct answer is it delivers the drug to the colon using pH sensitive coating because colon has a more basic, so therefore it does delivers right onto that one. So acetol is enteric coated release mesalamine, and also it is used as a anti-inflammatory drug for ulcerative colitis. All right, so this is a drug dosage forms and then mock test. So hope you like this one, and I'm confident this helps you to prepare and pass your board exams. So stay tuned for more videos and subscribe Pharmacy Prep channel. Until then, thank you.